Tēnā tātou katoa, good evening. If you've found it hard to get a doctor's appointment recently, there is a simple reason. GPs are in crisis mode.
In the past month, an unprecedented 155 GP clinics have issued a formal warning to the government, saying they're in danger of not being able to provide services.
It's been triggered by a pay claim lodged by the Nurses Union last month and what GPs say is years of inadequate funding of primary care. Investigations correspondent Michael Morra has the story.
Primary care is under the pump across the country.
I've been in practice 30 years and I've never been exposed to this level of stress.
It's the worst I've ever seen it. It's the most stretched it's ever been. It's the most difficult. It's the busiest.
Many practices are in financial strife and almost all lack staff and are overloaded with patients.
Any patient will know that they can wait 2, 3, 4 weeks to get a GP visit. It's not okay, and the health of New Zealanders are suffering, and we need to fix it.
Adding to the pressure, the New Zealand Nurses Organisation has lodged a pay equity claim with the intention of boosting pay for nurses in primary care.
We've got this significant gap between what nurses in hospitals are paid and what nurses outside of the hospitals in what we call the funded sector.
GPs want their nurses paid more, but say they can't fund it.
I think it's a disaster waiting to happen.
In response to the union's claim, since mid-December, 155 GP clinics have issued what's known as a Section 14 notice, which is a notification of problems or significant risks sent to their local primary health organisation, which is then obliged to inform the Health Ministry.
It needs to be funded by the government.
Health Minister Shane Rete won't commit to that.
I can't preempt budget decisions. We're sort of making our way through all of that discussion here now.
But he does want to give more money to GP clinics.
I want to better remunerate general practice.
Would that involve completely redoing the funding model?
I'm interested in exploring that.
GPs say that's critical, as they play a pivotal role in detecting medical issues early.
General practice is seen as the foundation of the country's health system because those who see their GP are less likely to end up in already overloaded hospitals.
It should be the foundation of our health system, and for a long time it's been a poor cousin.
Is it functional at the moment, general practice in New Zealand?
Well, if you can't get a GP, it's not functional.
And Angus Chambers says expecting GPs to fund nurse pay rises will have devastating consequences.
Do you think it could result in some practices folding?
I do, yeah.
Meaning it's the New Zealand public that will suffer. Michael Morra, Newshub.